Hi everyone, happy Wednesday. We'll wait just a few minutes.
Let some people hop on.
To join.
Happy New Year. I'm sure everybody's missed us.
Already 11 days into the new year.
Yes.
Flying on by.
Yes, ma'am.
Just a few people. If you are joining us today, don't be shy. Tell us where you're watching from.
Hi, Sue. And Sue. Minnesota.
Anna is with us. Brenda and Michael.
And Bridget and Robert.
Ann from Wisconsin.
We got a good group going right now. So happy New Year, everyone. We are finally back and we have Dr. Tony with us again.
Yay.
And he is going to answer all your questions about welcoming a newborn into your herd.
Yes, so if you are calving or kidding, foaling, lambing, learn about readiness prep, what to expect within the earliest hours, and don't forget to put your questions in the comments because Dr. Tony is back to answer all of them for you.
Yay.
So with that, Dr. Tony, we're going to turn it over to you.
All right. Well, hi, everybody. Thanks for joining in today. It's a very broad topic today. So please put your questions in there. I'd like this to be more of a discussion because I don't know that I'm going to be able to cover everything for all of these species here today at the time we have allotted. So if you don't mind, maybe put in the comments what species that you're really kind of listening for, and we can kind of use that to get where we need to be. We'll start with maybe some of the more popular species, but if anybody has any questions to get started off here, go ahead and put those in. I see a couple horses popping up, so we'll probably go ahead and start there. The description said readiness prep, signs to watch for, things like that. So we see some horses, some cattle. I see some goats on there.
Goats.
Okay, so
it's pretty much all of them.
Pretty much everything. So that's good. That's good. But like I said, we'll probably start with kind of some overview type of information because a lot of this is pretty similar for all of these species. There could be some species specific differences, but for the most part, it's pretty similar. So readiness prep. Probably the first thing to think about there is what you need to have on hand. Very importantly, you need to have a relationship with a veterinarian, and you need to have that veterinarian's contact information. I would strongly encourage you to develop that relationship, speak with that person before your foaling, kidding, lambing, calving season, okay? Rather than just calling that veterinarian at 2 o'clock in the morning. It's nice to know people before you get that call. So that's important. Have that contact information handy for when you need his or her help. Now, some equipment that you should have on hand. It depends on the species, but some overall general stuff to have on hand. Some gloves, some lubrication in case you need to help do some minor pulling or rearranging to help that animal come out. Iodine is helpful to have on hand for disinfecting the umbilical stump. And then if you and your veterinarian decide you need to give any vaccinations or medications at birth, have some syringes, needles on hand, and those medications. That's pretty good overview of what you need. Colostrum is important to have on hand because you never know when you might actually need it. So when you need it now, type of thing. So have a few bags of colostrum replacer on hand, and that way you can give it when and if you need to. Other than that, just those things that you do at birth. If you band them at birth and have those bands available, have a tetanus toxoid vaccine available, ear tags, those types of things. So really, it's a pretty basic list. Depending on your comfort level, really depends on how much of the equipment you need to have on hand for as far as helping that dystocia process through. So if you're comfortable, get some chains, get some handles. If it's calving, get a calf jack. If you're comfortable using them. If you don't know how to use them, they can be dangerous to both the mama and the baby. So if you're not comfortable, maybe if something's going wrong, just give your veterinarian a call and have him or her help you. So we see some questions popping up here. Equine, I'm just scrolling up here. I apologize. Equine early signs of trouble when foaling. So the biggest sign of trouble is one of two things. Either you don't see what you should coming, or it's not progressing like it should. So every species we're talking about today, the way they should come is kind of like how a diver dives into the water. You've got your front legs forward, okay, and they're kind of together, and then that head is propped down in between those front legs, okay? So that's the normal presentation. So you should see two hooves coming, and they should be pointed down towards the ground. Like the bottom of the hoof should be pointed down towards the ground, okay? If you only see one hoof, or you see a head, or you see two hooves that are pointed up like this type of thing, okay, or a tail, even something like that. If you see anything that doesn't look right, then that animal needs to be examined, okay, right away. Now, the other side of things, if you see what you should and the progress that you expect is not being made, then you need to examine that animal. So a general guideline for most species is 30 minutes. If you're not having any noticeable improvement or advancement of that fetus out within 30 minutes, then you need to have somebody examine that animal and see what's going on and maybe even help deliver that animal. Okay, good question. So Brenda asks, do you notice a permanent change in demeanor of a mare after her first foal? Calm, a high anxiety mare. And I don't, Brenda, I guess I haven't seen that. So I wouldn't really count on that being the case. Okay. Some yes, some no. Some get extremely aggressive after birth. Okay. So Cindy asks, what are the risks with red bag foals? That's a good question, Cindy. Thanks for bringing that up. So red bag, what that is that means that the placenta has detached early. Okay. And so what you're going to see is the water bag, I guess, come out, and it's going to have two big strips of maroon or reddish looking tissue on it. Okay. And that is an emergency. You need to address that immediately. You need to go up there and break open that bag because that means the foal doesn't have oxygen anymore. And so the foal needs to start breathing. Okay. And until you break that bag, the foal can't breathe, or he will suck in the fluid. Okay. So that's a very good question.
Okay.
I see a question by Jessica Gregory here. If we gave a rhino pneumabort vaccine in 5th and 8th month, should we give it in the 10th month or skip the 3rd? Yes, Jessica, you should go ahead and give it in the 10th month. Good question. Okay. Una says, both legs don't always come out perfectly together. How far back is too far back for the front second foot to be? Good question, Una. So you're right. Sometimes they're kind of I guess, off. They're not always perfectly together. As long as you see two front feet, that's okay. and as long as you're getting progress and both feet are coming out equally. So if you're seeing progress or one foot's only coming out, that probably means that the elbow or the shoulder is getting caught and it's not going to come out on its own. Okay. So if that's the case, you'll have to try to help provide some traction to get that second leg out. Okay. Good questions. Please keep them coming. I love answering the questions. I think it turns more into a discussion that way. So, the other thing to talk about with readiness prep is going to be facilities. You know, and you're kind of limited on what you've got available, and it really depends on the species. So, and it depends on the weather. That's a big thing to think about too. I'll take a pause here and answer this question. Best worming regimen, type of wormer for the mare prior to foaling and the foal after. That's a good question. So the best worming regimen, we'll start with the foal, is to use like a fenbendazole, like Safeguard, and do that every 2 months until they're 6 months of age. Okay, these are the kind of the generic recommendations by the AAEP. So at 2, 4, and 6 months of age, you give the fenbendazole Safeguard, or you can give pyrantel, and then at 10 and 12 months of age, you switch over to like an ivermectin-based dewormer. Okay. Now for the mare, prior to foaling, it's typically recommended to deworm her, you know, maybe a month prior to foaling. It's not as big of a deal with the mare, and it's really not a huge concern for the mare to contaminate the foal, just because there's so many parasites in the environment already. That's typically not going to be a huge issue. In a normal delivery, should we break open the bag if it isn't already torn? Most of the time, Sue, that's not necessary if things are going normally. Okay, because that bag will break open on its own. Is CMPK better for dairy breeds after birthing or calcium boluses? CMPK would be my choice because you do get that magnesium and phosphorus included. Typically, if calcium's low, phosphorus is going to be low as well. If a mare starts dripping milk and keeps dripping for 5 days, should I catch that milk, or will a colostrum come into the milk after foaling? That's a good question, Margie. So it really depends on the volume that she's losing. There is some colostrum included in that milk because they start to produce colostrum about 3 to 4 days prior. So a lot of times, if they're losing a high volume of milk that way, then the recommendation is to go ahead and milk them out, milk that colostrum, and kind of freeze it, and then thaw it and give it to the foal afterward. Okay, so you kind of have to use your judgment there. If you're worried about it, there's no harm in milking that colostrum. Okay, the signs of birth coming soon. That's a good question, Jade. So it's kind of the same for every species. Their muscles begin to relax in the backside, and so that tail head becomes more prominent. Okay, that typically happens about 3 to 4 days prior. Cattle, goats, and sheep, they tend to go off the feed. They tend to go by themselves, you know, maybe about a day prior, and that's kind of really the only signs that you see there. Horses, they kind of have more signs that you can look out for. The waxing of the teats. Okay. That happens, and then their bag gets distended. Same thing with cattle and sheep. Let me see. I made a list here because I knew I would forget. Okay, so the list here: the udder fills with milk 2 to 4 weeks prior to foaling. Okay, the teats become engorged 4 to 6 days prior, and then the waxing that I was talking about happens about 1 day prior to foaling. Okay. And then as that stage 1 of pregnancy, those contractions begin, then they do kind of start acting a little bit colicky. Okay. Cattle and sheep are the same way. Goats go off by themselves, go off of feed about a day prior. Watch that bag, that udder, it'll start to distend with milk a few weeks prior. So those are kind of the signs to look for. Okay. My mare has had 3 foals. I was present for the last 2. They both started out atypical, but at the shoulder, there's a slow in progression. The whole thing, both times, took her 45 minutes to an hour. Did she need me to pull that sooner, or should I wait for her to do herself? For how much longer should I wait? Okay, good question. As long as they continue to make progress, no, you shouldn't have pulled them. So about 15 to 30 minutes of no progress, yeah, you need to help. But 45 minutes to an hour for a full delivery, that's fine. You know, that's okay as long as they continue to make progress through that. Okay. All right, Laura asked about a reaction after getting a 5-way vaccine. It was given before she bought the horse. Should she split the vaccine into more than one injection? Yes, that's probably ideal. Typically, if we see these reactions, it's best to change brands first of all, and then to split that up into multiple vaccines. Commonly, the West Nile virus is going to be the one that causes that. So if you can at least get that one separated, then you should do that. Now, if you do separate these vaccines, give them maybe about 2 weeks apart, each one. Okay. Miniature Jersey cows, what age should you quit breeding them back? That's a good question. There's really no hard and fast answer on this one. Really, as long as they'll continue to breed, then that means things are healthy in there and okay. So you can expose them, and if they go a year or 2 without getting bred, it probably means they're getting old enough to where they shouldn't be bred anymore. Okay, the longest time from birth to first nursing that is safe. Okay, that's a good question. Miniatures, I believe our time frame is shorter than large horses. Okay, good question, Lisa. So colostrum is very important, and the majority of the absorption takes place in the first 6 to 8 hours of life. So you really want your foal to be up and nursing within the first 4 hours is going to be the guideline. If they're not, then we need to start thinking about getting supplemental colostrum or milking that mare out manually and giving the colostrum. Now, they can absorb the antibodies all the way up until 18 to 24 hours. So, but they just are not as efficient. So they don't absorb quite as many as they would early on in life. Okay. Okay, Sue asks, my maiden mare didn't wax, but I heard their udder will look shimmery or glittery. Is that so? I'm not sure about the shimmery or glittery, but that should be the wax that they're talking about. I believe that's what whoever told you that is talking about. So that wax then would have that shimmery or glittery look to it. Okay. Good questions. Good questions. Okay, the signs a doe will display when she's about to kid. Okay, good question. Kind of the same signs that we talked about earlier. They're going to get kind of restless. Their udder's going to start to fill with milk a few weeks prior, and then about 1 day before, those muscles will relax, so that tail head will look like it becomes more prominent. The vulva will start to kind of look like it's getting enlarged and relaxed back there. So those are kind of the signs to look for. And then they're going to go off by themselves, kind of go off the feed, and act uncomfortable. Should a pregnant mare be given a 4 or 5-way vaccine prior to due date? Yes. Yes. Whatever you commonly give her in the springtime is what she should get. Commonly, it's a 5-way vaccine, and you should give that 1 or 2 months prior to fulling. It's been a rather warm winter in New Jersey. Do temperatures impact the duration of pregnancy? Not really. No, nothing noticeably. So, okay. I think we're all caught up on questions. If you have any more, please keep them coming. But we were kind of talking about facilities. Like I said, you're kind of limited on what you've already got. Sheep and goats, if they're lambing and kidding in the cold weather, it's good to have someplace indoors to bring them. And it does not have to be like a completely conditioned indoors, but just somewhere to get them out of the weather. Okay, because those little guys, they're a lot more simple hypothermia. Okay, cattle and horses, those foals and calves, they're more able to handle those colder temperatures within reason. So if you're foaling and calving, you can let them calve out in the open, and a lot of times that helps with calf health. Now, foals, while you can, and while it would help minimize contamination, things like that, a lot of people recommend that you monitor that horse while she's foaling. Okay, so it's best practice to keep her like in a stall, like a large stall, so that you can watch the foaling process. Okay, so how frequently does prolapse in a mare occur? And that's very infrequently. So don't plan on it happening. But that's the importance of having your veterinarian's contact information on hand. Can you administer the pneumonia vaccine within a month of kidding? We do the CDT a month before. Yes, you can administer the pneumonia vaccine. Now, as long as it's a killed vaccine. I'm not sure which one you're talking about, but I assume you're talking about the Mannheimia vaccine, which is killed. But you do not want to administer any modified live vaccines at that time. Okay, several colostrum replacements on the market. Goat colostrum can be easy to get. Is one better over the other for horses? So it's best to get a horse-specific colostrum replacer or serum replacement. Okay, because these colostrum products, they come from hyperimmunized animals, and they don't immunize the goats and the cattle against the same diseases that horses will face. So the very best is going to be from the mare. So if you're able to at least milk her out, then do that. Ceramune is a very good horse colostrum replacement product. And then if you're not able to do any of that, you always have the option for a plasma transfusion after that foal is 24 hours old. The vaccine's best for calves with no natural colostrum. Okay, so I'm assuming your question is like calves that don't receive enough colostrum. And so you're just going to want to give some vaccines that provide some generic overall protection. Like an intranasal vaccine is great for those babies. Enforce 3 or Nasogen 3 be a good product. A 7-way black leg to get that protection going. That's probably what I would start with. And then if you have any specific problems, you can address those. Okay, several lambs present with a leg back and they were difficult to get out. Is there something such as a mineral or supplement that we were missing that will help deter this? No, there's no minerals or supplements that you can give to help prevent that. It's not a mineral deficiency issue that does that. So that can be a tough one to correct. All right. Okay, the hip bones are showing. Okay. I'm not sure about this question. We'll probably go to the next one.
Okay. Well, if I could find it, I would.
Lots of questions. We lost our place here.
This thing's jumping around.
The mouse is not cooperating very well with us today.
Let's look at that one.
Okay. I have a ewe that is rejecting her lamb. All right. Kind of their snubber typers. Okay. Sorry, I'm trying to read the whole thing through here. Okay, so yeah, the likelihood that she does accept that, as long as you keep working on her and helping him to nurse, it's pretty likely that she will end up. Sometimes it takes a couple weeks of kind of facilitating that nursing, and it's frustrating and it's not fun for anybody. But yeah, it's likely that she will eventually accept it. All right, if a mare delivers her first foal without waxing, Can I expect her to do the same during following foalings? So no, so a lot of times first mares, maiden mares, they don't wax. I'd say it's not uncommon for that to happen, but she should wax during following foalings. You should expect her to. Yep, good questions. Yeah, it's kind of out of the range of what we're doing today. So this is just kind of general information. Not trying to diagnose anything here. So, are there any more questions?
Let's see.
No. Okay.
Just this one.
I think that's the last.
That's the
question.
last for now.
Maybe.
Sarah says she had a question. Okay. About the toxemia. Had a doe kid with toxemia and it recovered well. If I wait a year and a half, is she most likely to have it again? I know feed has a lot to do with it. Just curious if this
I didn't see that one.
No, it's not a recurring problem, Sarah. It has everything to do with the energy level of the feed and how many fetuses are in there. So typically it happens with triplets, sometimes with twins. But just make sure during that last part of that gestation period to really increase the value of that feed. Okay, so give some really high nutrient feed to try to help prevent that problem. How long do you keep ewes and lambs separated from other sheep? You really don't need to. I mean, as long as that ewe accepts that lamb, that would be the only length of time that you would need to do that, just to make sure that she accepts those.
There's a yearly question.
Is the same with goats?
Yes, there's goats. Yep. The other, I guess, consideration there is making sure that none of the other herd mates are aggressive towards the babies.
Yes.
That would be removing that aggressive herd mate rather than keeping the ewe and lamb separate.
Yeah.
The best time frame to wean a foal. I saw that pop up here. So typically it's done about 6 months of age. You recommend giving newborn foals glycerin, supplements, or enemas. The enemas are only necessary if they don't pass that first meconium. So you kind of want them to pass that meconium within 12 hours of birth. If they don't, then typically you do need to give an enema. Okay, how old is too old to breed a mare if the history is unknown? Good question. I guess it depends on the status of the animal. So there's horses in their low 20s that are very healthy and they can carry a foal. But then there's other ones that kind of have some more health issues. So I guess I'd speak with your veterinarian about that question and take it on a case-by-case basis. Anything special for feed with mare that is pregnant and nursing? Yeah, you just want to make sure you give them enough energy. That's going to be the most important. So they should be able to get enough calcium pulled from their bones to support that. But giving some alfalfa, something high in calcium to help keep those bones strong would be a good idea too. You just kind of want to use their body condition. Adjust that feed depending on if you're starting to see more ribs than what you like, or if they're starting to get a little overweight. But typically, if they're nursing and things like that, lactating, they're going to have a lot of calorie requirements. So you're going to want to give them quite a bit. Gestation, not quite so much. As we get later in gestation, towards that third trimester, then yeah, you should start to bump their feed requirements about 20 to 25%. Okay, so Michael asks, how long can you wait to give the official calf foot vaccine? No, that has to be done when the calves are between 4 and 12 months of age. So that has to be done by a veterinarian. How do you apply iodine to the umbilical cord? Do we cut the cord, or does mama take care of it? Good question, Jade. So the easiest way, I guess, for me is to get a spray bottle and just spray it onto it. So it's not recommended to cut the cord because those vessels have to pull apart and stretch to contract down. If we cut it, then we can have some bleeding issues. So typically it happens on its own. Now there's some debate on to whether or not to clamp or tie off that cord. My opinion on it is that if you see the animal born and you go up and disinfect that, I think it's a good idea to tie off that umbilical stump. Now, if you're not able to do that within the first 3 to 4 hours of life, then don't do it, because if there's any contamination up there, you're going to trap it in and cause maybe an infection to get started up in there. Okay, good question. But the spraying is easier for me personally than have like a cup and to dip it, because that doesn't work very easily for me, because they're always fighting you and flailing around. So. How soon after lambing should I deworm my ewes? So, I mean, typically the recommendation is maybe about a couple months after lambing to deworm the ewes. Same with the kids and lambs. Okay. Good questions. Good questions. Just trying to see if there's anything else that I had noted here to talk about. You guys have pretty much asked everything that I had down. I guess I will mention that with sheep and goats, especially, some medications that you probably think about giving to the lamb and the kid. It's very common to give them vitamin E and selenium to help prevent white muscle disease. So there's just a lot of areas in the United States that are deficient in that, and so it's kind of a risk for them. They tend to be at higher risk than other species do. So there's some oral products that you can give that are very safe. You won't overdose them or anything like that. Okay.
A couple more questions came in here. We need a bigger screen for all these questions.
Yeah.
Common pregnancy ailments with goats. Good question.
Um,
So, infectious abortion is always an issue with any pregnant animal. That's why we try to vaccinate them prior to becoming pregnant. There's other things that cause abortion, that issues with the fetus or the embryo, or injury, trauma. So those two are fairly common with any species. Goats and sheep specifically, we kind of mentioned it before, but pregnancy toxemia. And what that is during late gestation, if they've got twins and especially triplets, those fetuses start to draw a lot of nutrients from that doe, that ewe. And so it can make them ketotic, and it can make them very low on energy, and so they get very sick. So we need to adjust the diet accordingly during that last trimester. Those are probably the most common things to think about with goats, specifically related to pregnancy and gestation. What dewormer is best for baby goats? Yeah, I wouldn't say there's one that's the best. There's some choices out there. It really just depends on what's been working for your herd. For resistance issues. Resistance is out there. I like the Safeguard. It's a great dewormer. Oral Sidectin's another good choice, but I'd encourage you to work with your veterinarian on doing some fecal egg count reductions and really evaluating what dewormers work for your herd. Any tips on getting a kid to nurse or find the teat? No, I don't have any miracle tricks for you. It just takes a lot of work, just trying to get that teat into the mouth, milk fluid into the mouth, trying to stimulate that suckle reflex. So takes a lot of time, takes a lot of patience. It's tough. So good luck. Do we apply iodine to a foal like a calf? Yeah, you should. You should spray iodine onto the umbilical stump.
Oops. There it is. Right here.
This one.
I think that was it. Yeah.
6 to 8 hours for colostrum. Is that standard across all species? Llamas, alpacas, goat, sheep, cow. Yes, that's very standard. So, and that's the ideal, best time frame to get that colostrum into the animal.
Mm-hmm.
Vitamin B complex for lambs. Yeah, I mean that's a good one to have on hand too. It helps stimulate appetite if they're kind of off milk or off feed, then they can become deficient in B vitamins. How soon do we give selenium to a lamb? I mean, you can do it as soon as that lamb is up and it's doing okay. I mean, you don't want to give it right away. Give that lamb some time to bond with its mama, but within the first day of life, you should be okay to give that selenium. Okay, at what point do you give vitamin selenium to the doe before delivery? Good question. About a month prior is the best time to give that. When rebreeding a cow, are there advantages or disadvantages to waiting 10 months to a year? Okay. Yeah, interesting question, Michael. I mean, a lot of times, I guess the disadvantage would be the economics of it. So most of the time, livestock are kind of an investment, and you expect kind of return on that investment. So the goal is to get one calf a year out of that, and that would be best for your management and your return. And that cow heals up. That involution of that uterus is done within 60 days. So she is ready to be rebred 3 months after she calves. So it's not harmful for her to get rebred that quickly. Signs, that's a good question, Mindy. Some signs or symptoms of fescue toxicity in bred mares. What do you recommend to treat them? So fescue toxicity can cause some issues with foal, and it can also cause issues with lactation. It prolongs that gestation period. So that foal kind of gets big, it's kind of over mature, if you will. So that's not good. It makes it harder, it makes dystocia more likely, those types of things. And then also it diminishes the milk production and lactation. Okay. Now the most obvious treatment is get them off the fescue. Try not to let them graze on fescue during the last trimester of pregnancy. But there is one medication, it's called Bone, and that's the only treatment that I'm aware of. That's kind of like a pharmacological treatment. So, but that would be something to speak to your veterinarian about as far as getting that. What selenium is best for a doe before kidding? There's some oral tubes that I would recommend giving. And they've got vitamin E and selenium in combination. So Valley Vet does carry a selection of those. Any shots or vitamins advised to have on hand for a foaling mare? No, not really. Mares and foals just don't tend to have the deficiencies that other species can. A large sheep rancher recommends giving scour guard to new lambs. Would this be helpful or harmful? I don't see it being harmful. I guess it depends. Scour guard, those scour vaccines are intended to be given to cattle and pregnant cows prior to calving, so that immunity passes through the colostrum. The issue with giving those products to baby calves is, in this case lambs, is that you require 2 to 3 weeks to respond to that vaccine. So you give a vaccine, 2 to 3 weeks later, they have immunity to it. The other issue is that those scour bugs are ingested, they're in the gut. And so giving that immunity through a vaccine in the bloodstream typically isn't as effective. So I don't know. I've never heard of or done scour vaccines in lambs, so I don't know whether it would be helpful or not, but I don't see it being harmful. Now, if you're giving that to get the C and D protection, then yeah, that should be helpful. But there are also other products you can give for that CD protection, refrigerants type C and D. A doe lost her kids. How long do you recommend to wait to rebreed? Do you recommend giving her anything before rebreeding? So it depends as far as giving her anything. If she's infected, if she's got an infection of the uterus, something like that, endometritis, then yeah, you need to treat her. But normal healing and evolution should happen within 50 to 60 days. So waiting that 3-month period should give her plenty of time to be ready to rebreed.
Here's.
Okay. Gave the rhino to the mares and gave a 5-way a month before foaling. Is it still effective 60 days before foaling? Yeah. I mean, it would still be effective 60 days before foaling. The reason it's recommended to be a month is because that's where you're going to get the most benefit for your colostrum. Okay. But giving it 60 days prior to foaling is better than not giving it at all. The warning signs to watch for in the mare and foal for the first 48 hours after foaling. Okay, good question. This kind of brings up something that I did want to mention that I forgot about. With the mare, it's important to make sure they pass that placenta. Okay, if they have not passed the placenta in its entirety within 3 hours after foaling, then you need to get somebody out there to look at her. Because that can cause some infection issues, laminitis. I mean, it causes a lot of problems with the mare. So the major problems to look for, obviously that placenta issue, and then really any signs of sickness. Make sure her udder looks okay. Make sure it's not getting bigger on one side than the other. Make sure it's not getting hot or sore. And then with the foal, you want to make sure that it's active. You want to make sure that it can stand and walk okay. Sometimes they'll have some limb deformities. So if you're seeing any of those where it's walking like it's knuckled over on its knuckles, or its legs are misshapen, I guess, then maybe have somebody out to take a look at it. But make sure it's active. Make sure it's nursing. If they start to act lethargic and they quit nursing milk, then that's kind of a warning sign that they're starting to get sick. Okay. How common is it for diarrhea during the mare's foaling heat? It's very common. I mean, it happens all the time. So it's really not a concern. Do they eat the placenta like horses? Do horses eat the placenta? They can. Yeah. Typically, you don't want them to, though, because you want to make sure the whole placenta came out. So best to examine that placenta to make sure no pieces were left behind. Cattle, sheep, and goats are not the same as horses. So I'll come back to your Sue question. I'm sorry. I'll come back to your question, Sue, but let me just finish this point. They don't need to deliver their placenta within 3 hours after birth. Okay. 3 days is how far they can go before they need to be evaluated. Sometimes it takes a couple days for that to come out. It's not as big of an emergency in cattle and sheep and goats. Yeah, Sue, the full diarrhea, I knew what you're talking about. But yes, the diarrhea is very common at that time frame. Any concerns with giving multiple vaccines and deworming at the same time, such as CDT and chlamydia? As long as the animals are in good health, typically not. Okay. specifically those two vaccines, you should safely be able to get them together. And deworm. The deworming, it doesn't really affect anything with vaccines.
You're all caught up for now.
Well, I don't have anything else that I had down to mention. I will say from experience that having a warming room or a warming box of some sort can be a lifesaver, literally. So in the winter, we've been getting some really cold stretches here these past few years, and those warming boxes have helped a lot of producers pretty significantly. So if you don't have one, I would definitely look at getting one. Okay, so an umbilical infection last year, treated with iodine immediately after birth, caught it early, any causes. Umbilical infection is entirely, it's they pick up those bacteria from the environment. So there's only so much you can do. You did the best you could, treat it with iodine, try to prevent it from happening. But if they're laying in mud or even in the dirt, those bacteria can travel up that umbilical stump. How important is it to have a vet out after foaling, so long as things went well? Yeah, good question. It's a good idea. I mean, it's a good idea to have your mare examined and your foal examined. Give them a few days to make sure everything's okay, make sure that they're bonding okay. But yeah, 2 to 3 days after they foal, it's never a bad thing to have those animals examined to make sure everything's okay. Yeah, good question here, Shannon. How often do you recommend deworming horses? Lately, I've heard about overworming. So it's really should be on a case-by-case basis. So I'm just going to echo here the AAP recommendations because I think that's the best practice here. And they recommend doing a fecal egg count on every horse every year. Okay, now this will tell us how many eggs per gram are in that horse's stool, okay, and the manure. And then that information will tell us how often to deworm that individual horse. So we really shouldn't be making blanket recommendations anymore about, horses should be dewormed 2 times a year, 4 times, 6 times, I mean, whatever. We shouldn't make it blanket recommendations anymore. We should treat each individual horse as an individual. I know for some bigger ranches that can be a little bit of a challenge, but the thing about it is that only 20% of the horses, I might get this a little wrong, but it's a crazy number. 20% of the horses produce 80% of the parasites that are on the pasture. So why do we need to deworm that other 80% so heavily? We really don't. We need to deworm those high shedders, that low population of horses to draw those parasite levels back. So depending on what that level is, the recommendations are 2 times a year for the low shedders, 3 times a year for intermediates, and then 4 times a year for high shedding horses.
Must be an emoji there. I can't see what it is.
How do we clear the nose and mouth after the lamb is born? Is that necessary? Most of the time it's not necessary. So if it's a normal, uneventful birth, then no, you don't need to do that. Now, during a dystocia, when you're hoping to deliver that animal, most of the time you should try to help that animal clear the mouth. A bulb syringe is the best way to do that. So you put that bulb syringe in each nostril and suck it out, and then down back into the throat to suck it out. It's not recommended to hang animals. Okay, that's something that was done in the past, but they found that the weight of the abdominal contents actually pushes on the lungs and makes it harder for the animal to breathe. So that's the current recommendations there.
I am not sure what that is supposed to be after entire, but maybe Jonathan can clear that up for us. I'm not sure.
Jonathan, were you questioning a certain animal that you put an emoji in there for or something?
Yeah, clear that up, Jonathan, if you would, and we can sure answer that. I think Tina came up with a question. Okay, somewhat new to raising cattle. When will your cow breed after calving? How many days are they in heat? So they're in heat really only 1 to 2 days, okay, is their estrus. So you got a short window there. After calving, it depends on the animal, it depends on their condition, their body condition, but typically within 60 to 90 days after calving, they should start to cycle again. How harsh are dewormers like ivermectin on a sick, anemic goat? Should the focus be on dehydration and nutrition before deworming? Yeah, dewormers are very safe, so they're not going to stress that animal out anymore. Focusing on nutrition and dehydration is important, but unless you take care of the reason for that anemia and that dehydration, then you're going to have a hard time getting ahead of it. Good question. Do we need to vaccinate older cows in your herd? Okay, so sounds like what he's asking is if you need to vaccinate the entire herd every year for some reproductive diseases, is my assumption. Yes, Jonathan, I would recommend doing that. That way it keeps your herd immunity level up. You know, even if the older cattle maybe have a certain level of immunity built up, they can still shed, like, for example, leptospirosis. So it's a good idea to vaccinate the entire herd every year.
Okay. That's all for now.
Okay. Well, we still have a few more minutes, so if you guys have any more questions, we can sure address them.
There's a new one.
Some people say that goats cannot get bred in the fall months. Is this true? It takes more work to get them bred outside of their season. So goats are short day breeders. Okay, so we have to kind of work with them hormonally and with lights and things like that. But they can. There are operations that breed goats year round. Do wormers compromise the goat milk for human consumption? It depends. There are some wormers labeled for dairy goats, and they don't have a withdrawal listed on them, but always be sure to follow that withdrawal time. I give BOCI and CDT boosters to my goats before kidding. How soon to vaccinate the kids afterward? Good question, Lori. You should, if you give it before kidding, you should give kids vaccines at 4 to 6 weeks of age, with a booster about 4 weeks after. Question. Oh, yeah. Kind of off topic here, but how important is it to vaccinate barnyard chickens?
This is our first chicken question.
Yeah. I have to admit, I'm not much of a chicken vet, but I know a little bit about them. It depends on their level of exposure. I mean, there's a lot of barnyard chickens or backyard chickens that aren't vaccinated, but I do think there are some ones that are good to give. Fowl pox would be one vaccine that I like to give, and Merrick's disease if you're able to. Other than that, it just depends on what kind of issues you have, if you have issues with respiratory disease or not. So, tetanus vaccine. Do you recommend a tetanus shot at the time of banding and additionally 2 weeks later? Yes. Yes, you need to give tetanus toxoid if you're banding cattle. Now, the best thing to do is to give a tetanus toxoid 2 weeks prior to banding, and then a booster at the time of banding. Mares tend to foal in the middle of the night when the vets aren't in the office. That's very true. Would it be best to call the vet's office to give them a heads up when or if you see signs of impending foaling? Yeah, I mean, I think that's reasonable. That just goes back to the importance of developing that relationship with your veterinarian. You know, if you know you're gonna breed your mare, or you have a mare farm, or a brood mare farm, yeah, you need to have that discussion with your vet and ask them what they want you to do. So yeah. The recommended vaccine worming schedule for foals. So that's a good question, Mindy. Um, we'll jump back to the AAP guidelines here. So we were talking about adult horses earlier with the worming recommendations. The AAP actually recommends deworming foals a little bit differently, and they recommend giving foals dewormer every 2 months until they're a year of age. Okay, so you'd start out at 2, 4, and 6 months of age with Safeguard or a similar product, or like a Pyrantel-based product, and then at 8 months of age, you would then switch over to ivermectin-based. Okay, and at 6 months of age, you should probably do a fecal egg count, just to see what that population of parasites is. Okay. Do you recommend tetanus for sheep as well? Yeah, if you're banding them, if you're banding tails or castrating by banding, you should give a tetanus toxin. Okay. My Jersey heifer is bred by a neighbor's Gelby bull. How would I know if my Jersey is going to be able to beat the calf without problems? I'm concerned the calf would be too big. Yeah, I'd be a little bit concerned too. I don't know. I don't have a great explanation for it. I mean, you're just gonna have to keep an eye on her. So there's no way to really tell before it happens. Okay, update on all shots, but I have not given the strangles vaccine. Do they need this too? She does get the shot every 2 months to prevent abortion. No, they don't need the strangles vaccine. I mean, the strangles vaccine is only an at-risk vaccine. So if they're going to be exposed to it, then at that point they would need it. But pregnant mare probably shouldn't be getting that level of exposure. So it's not commonly recommended for pregnant mares.
I think we kind of answered that.
At a boarding facility, how soon can the mare and foal be turned out with the small herd? Good question. I'd wait till that foal's probably a couple weeks old. Give that mare and foal 7, 10, 14 days to bond, and then turn them out. Again, you got to watch everybody. Make sure nobody beats up on the foal. Make sure everything's going okay, because that herd pecking order, you can't outguess that. So as long as everything's okay and everybody treats everybody okay, then yeah, you can turn them out at a couple weeks of age.
Okay. All right. Well, Dr. Tony, did you have anything to add before we wrap up our segment?
I don't think so.
I think you've covered everything.
I think we covered everything. There was a lot of good questions in there.
Yeah, there were. Awesome. Okay. So we do not have anything to throw confetti for at the end of this video, but I think it was pretty productive anyways. We had lots of viewers. Thank you everybody for watching. Thanks for all the questions. And thank you, Dr. Tony, once again.
Okay.
And we guys will start doing these pretty much every week on Wednesday. So make sure you check out our events on Facebook, and make sure you're signed up for emails and our text messages to be alerted. So,
and join us again next week. We'll be back.
Okay. Thanks, everybody.
Thank
you,
you
guys.
Bye.